thankful to the I am thankful to the people who are cooperating us. In this webinar, PMA is also cooperating with us, and Dr. Salman Kundi, President of Pakistan, PMA, and Azad Jammu Kashmir Medical College, Muzaffarabad, Women Medical College, Abbottabad, Pakistan Physiological Society, PMA, and so many other societies are joining. Today's, I'm highly thankful to the Vice Chancellor of University of Child Health Sciences, Professor Masood Sadiq, for his always cooperation in research and other things with us, Azad Jammu Kashmir Medical College. So before starting this, I will request Dr. Rashid Mahmood to recite Holy Quran so that we can start this webinar after the holy verses of the Holy Quran. Thank you so much. Over to you, Professor Rashid. I will request all other people to mute so that there should not be any disturbance.
राइट जज़ाकल्लाह सर सर ये थोड़ा सा बैकग्राउंड पे अगर शोर हुआ तो माफी चाहता हूँ एक क्रिकेट मैच है वहां पे मैं
but it is always welcome.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم أرأيت الذي يكذب بالدين فذلك الذي يدعو اليتيم ولا يحض على طعام المسكين فويل للمصلين الذين هم عن صلاتهم ساهون الذين هم يراءون ويمنعون الماعون صدق الله العظيم तर्जुमा क्या तुमने उस शख्स को देखा जो रोजे जजा और सजा को जुटाता है यही है जो यतीम को धक्के देता है और उन्हें अपनी जो यतीम को धक्के देता है और उन्हें रुग़बत दिलाता है मिस्कीन को खाना खिलाने की बस खराबी है उन नमाजियों के लिए जो अपनी नमाजों से गाफिल हैं जो दिखावा करते हैं और जो आम जरूरत की चीज भी मांगे नहीं देते सदक़ल्लाहु अज़ीम
Jazakallah. Thank you very much, Professor Rashid. Thank you very much, Professor Rashid. And today I will love to introduce the today's speakers. Dr. Wajia Rizwan is the Associate Professor of Pediatrics in University of Child Health Sciences. She is a very active, she is an electron. Like she is very active, she worked so much during our COVID period. And she also constituted a group on the Facebook and the social medias to guide the people who are suffering with COVID. Dr. Wajia Rizwan has another credit with Dr. Wajia Rizwan and Vice Chancellor Masood Sadiq Saab. She wrote a first article which was published in highly impact factor journals, and almost I'm looking more than 70 citations from her articles. And another speaker, Professor Masood Sadiq, is the Vice Chancellor of the University of Child Health Sciences. Nutita, he is the cardiologist. He is the world-known Pakistan-known specialist cardiologist of the Pakistan. And another very key important speaker, Dr. Junaid Rashid, always with us. He also spoke so many webinars on the COVID. Sir, we are highly obliged because we know yesterday I visited a university, but I could not see you. I could not meet you too because you are busy. Anyhow, sir, and our third comments will be from our Professor Tahir, because our team is visiting third medical camp in the KPK in the Dera Ismail Khan, and we are looking so many problems in the childs because the childs are very important. We are not looking only the problem in the child, we are also looking the long-term problem that the newborn will face due to this flood-affected area. Now over to you, Dr. Wajiha Rizwan.
Assalamu alaikum, sir. I'm highly grateful to this platform, especially you and Madam Salma, for giving me this opportunity. And I really feel honored to speak on this platform in front of the legends of medical community of Pakistan. Especially, I'm grateful to Professor Junaid Sahab, my Vice Chancellor Masood Sadiq Sahab, and Tahir Sahab for joining today. Just before starting my presentation, I will start it with Rabbi Shrah li Sadri wa Yassir li Amri Wahlul Uqdatam min Lisani Yafqahu Qawli. I am Dr. Wajia Rizwan and currently working as Associate Professor of Pediatrics at University of Child Health Sciences, Lahore. I was very fortunate enough that my Head of Pediatric Medicine, Professor Junaid Rashid Sahab, Vice Chancellor Professor Masood Sadiq Sahab, and Vice Chancellor Fatma Jannah Medical University, Professor Khalid Masood Gundal Sahab, let me lead the first team that went to Sindh to the Sevan Sharif. That was one of the most affected area of the Sindh and was also having refugees from all over the Sindh. So what I will be talking today will not only be from our previous experiences, but also pertinent because what I have seen and experienced during my stay in Sevan Sharif, Sindh. We will be discussing long-term effects of flood on the health of children in flood-affected areas and how to manage them. When we talk about children, children are 1/3 of population and all of our future. So please remember when I am referring children, I'm talking about the future of Pakistan. We will be discussing the background impact of flood on children in form of consequences on their physical and mental health and education attainment, and the possible solution for which I will be expecting a very productive discussion. Now, the flood has affected, this is one of the most severe flooding in Pakistan's recent history that has affected almost 33 million people, 16 million among them, that makes half of the affected population constitutes of children. And around 3.4 million children need urgent assistance. There are also increased risks of preterm births and neonatal mortality because there are a lot of pregnant women, around 74,000. They are living in miserable conditions. They have no proper nutrition. They are undergoing a lot of stress and trauma, and there is high risk that the fetal growth will be affected, and it can lead to preterm labor. And we will have many preterm newborns, and that might increase the neonatal mortality. Why and now why pertinently children are vulnerable and why we should be focused on them when they constitute the half of the affected population of the flood victims. Children are generally also considered vulnerable during disasters because they are dependent upon the caregivers. They may lack communication skill. Sometimes they are young enough. Sometimes they are not able to communicate what they require. Just it was my observation that I found a lot of children that were infants and newborns that were having skin burns because they couldn't move out of the place, and their skin got burned due to the sunlight. They may have special needs, specifically the children who are mentally bit retarded, or they may be dehydrated easily. That's because their overall body surface area is larger and their water reserve are somewhat less than adults. Especially, we all know that in newborns, the immunity is low, so they are more prone to infections, and they are emotionally also labile. They find it very difficult to cope up with stress, and such a stressful environment when they are displaced from their homes, separated from their families. Now, how the flood affects the people? It can have primary effect of the flood is due to the direct contact of flood water, and it can cause physical damage. We have seen that a lot of buildings, people have lost their homes, they have lost their agriculture crops, we have lost schools. And then we can talk about the secondary effects of the flood. These are due to the results of the primary effect, due to the disruption of essential services. And if we are not able to tackle these secondary effects, it can cause long-term consequences that will not only affect the economy of the Pakistan, but also the future. Now, talking about the effects on children, how the flood affects, they are the secondary hazards that the people people or in children, specifically when children are exposed to the water or moisture. Specifically, moisture can lead to the molds and fungal infections in the people living in the refugee camps. There may be disruption of medical care due to the damage to the medical healthcare facilities, and because the roads are all underwater, so many times it is not easy to reach that area. Now, let me share an experience that when we were advised by our government of Punjab to reach Seven Sharif, and when we reached Sakhar, there was all the district government was telling us that it is totally impossible and we can't reach Seven Sharif because all the roads are cut from that area. But we decided that if you are saying that it is impossible to reach there, then we must go there, because it means that most likely the aid haven't reached there earlier. And people may be affected due to the community contaminated water, leading to the waterborne infections. There may be shortage of food and creating food insecurity. There may be issues due to the evacuation and displacement. There may be effects due to the mental shock people are facing because of losing their families or their properties. If we, these can lead to the, this can lead to the short-term outcomes in form of deaths. We have seen that almost 1,500 people have died during this flood. That may be due to drowning or injuries. There may be infectious diseases, poisoning due to the contaminated water. People may have allergies. That's why we have seen that the major bulk of patients we have seen are having skin allergies or skin rashes. People, especially children, are prone to hypothermia. There may be animal bites, such as snake bites or dog bites, or there may be stress. And if we do not act timely, these short-term outcomes can lead to the consequences, such as a country, we will be more pushed into the poverty. We will have more burden of chronic malnutrition. Illiteracy rate will increase in our country. It may add up to the disability, and it may add to the psychological consequences. Children may go through depression and long-term anxiety or post-traumatic stress disorder. To simplify it, I will limit my impact of flood on children in 3 categories. I will be pertinently focused on physical health, mental health, and education attainment. There are a lot more issues, but these require political commitment, and as we all know that there is a lot of political polarization at present in our country. So I will like to limit my talk to the effects and the impacts in which we can play our role as healthcare professionals. Now, first of all, talking about the physical health, it may be physical health may be impacted in form of poor nutrition because they are not getting enough food, and due to the poor hygienic conditions or sanitation, overcrowding. I saw there was just literally a bed sheet, and almost 7 to 8 family members were just sleeping over there with pregnant women lying under the sky. There may be lack of vaccination. When I met DG Health Sindh, he was saying that we are much worried that how we will be providing EPI vaccination to the children living in the refugee camps. And because all the majority of the healthcare facilities have been damaged, so medical care is also disrupted. And when these pregnant ladies and sick people are not getting effective medical treatment, it will definitely increase the morbidity and mortality. All these, when physical health of the children especially can also be affected due to the child abuse and neglect. And how is it possible? I will be discussing it later. Mental health, in particularly of children, is affected because they have lost their homes. They are no more going to their schools. Someone has lost their friend or family member. Family is going through financial crisis. And when you're facing financial crisis, many times the parents also and the caregivers get non-supportive and sometimes abusive. There may be physical, psychological, or sexual abuse. And where I am talking about the previous survey from 2010 indicates that there were almost 6% women in specific who faced the sexual abuse, and almost 50% faced the domestic violence. And so is true for the children. And then it may affect the education attainment, because education is not our priority. We are much more focused at present on the providing food and shelter to the people, and we are not at present not at all focused on the education. Schools have been damaged, and there are financial constraints that by many times family push their children into the child labor instead of sending them to school. Now, talking about the physical health, short-term consequences of flood can be in the form of infections. There are increase in the waterborne infections in the form of diarrhea, typhoid, dengue, malaria, cholera, or respiratory tract infection. As a pediatrician, what I have seen in the Sevan Sharif, there were majority of the cases were of patients having diarrhea and respiratory tract infection, maybe due to the overcrowding and poor sanitation and unavailability of clean drinking water. Then I found that the most of the patient, especially infants, were dehydrated. That may be due to the sunlight exposure or diarrheas or unavailability of clean drinking water. This was leading to acute malnutrition as the children were not getting proper food and nutritious foods, and also the psychological upset was also adding up to the gravity of the situation. Then we can also have animal bites, especially mosquito bites, snake bites, and then trauma. If we do not act timely, this can lead to long-term consequences in the form of these long-term consequences on the physical health will be more severe if malnourishment starts in the womb of the mother and early childhood. We can have preterm and low birth babies. It can lead to stunting and chronic malnutrition if we do not provide them adequate nutrition and nutritional supplements at this time. And when they are malnourished and deprived of the vaccination, therefore, for sure, they will be having poor immunity, and there will be a vicious circle of malnutrition, infection, adding up to the disease burden. Then talking about the mental health, in short-term consequences, children can have depression, anxiety, and when many children, young children who don't know how to express, who don't have a proper communication skill, then their depression and anxiety comes out in the form of aggression. Especially younger children, it is found that the younger children and girls are more prone to post-traumatic stress disorder. And last time surveys showed that many children who were the victim of the flood had insomnia, they had night terrors, they have used to get dreams of losing their family members, or they even had a fear to, even when they saw water, they were afraid of water because it gave them flashbacks of the flood times. Long-term consequences can be on the mental health of the children can be minimized if they have got supportive parents, and it is also dependent upon the stage of physiological psychosocial development of the children. In long-term basis, if we do not act timely, it can lead to behavior disorders. These children can, when they are deprived of education and after going through such psychosocial trauma, they can have low IQ and also be a permanent patients of post-traumatic stress disorder. Education attainment. Now, this topic and this impact of flood is very close to my heart because it is the most neglected area at present. So I will be speaking a bit more and highlighting this issue more. And just sharing a cutting of a newspaper, it says children in Pakistan were already set back by COVID. Then deadly flooding hit. Millions are locked out of the classroom after 18,500 schools were destroyed. And there are fears that many may never return. Impact on education. Pakistan already ranked 125th out of 130 nations for quality of education. And this I am referring World Economic Forum of 2017. Flood, this is the recent situation report of UNICEF from the last night, that flood destroyed over 23,900 schools, and those which are intact are housing victims. When we were having camps in Sindh, we found that the most of the camps were organized in the schools of the Sindh, and there are 20,000 kilometers of roads are under water. That means that the way to the school is also disrupted. This is a statement of 14 years old boy statement regarding school. He says, there is mud everywhere, but I can see school walls have collapsed. It makes me cry when I see my school in this condition and teachers say that it will take time to open. I want to go school, study and play with my friends. I want it to open immediately, but I am totally helpless. A 14 years old boy's statement that I am totally helpless is a big question mark on the role which we need to play as a nation. Now, what are the challenges when we talk about the impact of flood on the education? Providing food, shelter, and medical care to flood victims is a costly priority. Education is just nowhere in the picture right now. Dropped out students might not just enter the workforce, but child trafficking and early marriages could take place. I have talked about what I have talked about is from my experience and from the literature, but I want you to see a small video that is related to our visit to Sindh. I'm again highly grateful to VC Professor Masood Sadiq Saab, VC FJMU Professor Gondal Saab, and my head of pediatric medicine department, Dr. Junaid Rashid, for providing all the funds that we could go to Sindh. We not only held medical camps, but we also distributed food ration bags to almost 1,500 families, provided mosquito nets, and we also distributed almost cash of around 10 lakh. So just, I will be showing this video.
डूब रहा था तो फिर ये देखा था
परेशान हुई है बेटा कहाँ से
अच्छा ऊपर देखो बेटा, ऊपर देखना है। ठीक है जनाब, कहीं दर्द तो नहीं हो रही पेट में? किधर कहती है? पेचिश कितने आ रहे हैं?
इसको दूध बस रो रहा था, डब्बे का देती हूँ अभी।
नहीं, अपना क्यों नहीं दे रही इसको?
नहीं खाने के लिए, माँ खाना खाऊंगी तो दूध बनेगा, खाना ही नहीं है।
खाना ही नहीं है तो दूध नहीं आ रहा। पहले बच्चों को अपना दूध दिया था और इसको नहीं दे सकी, कोशिश की थी।
की वजह से यहाँ आए हैं। अभी तक कोई यहाँ नहीं आया, हमें राशन भी नहीं मिल रहा। फौजी आते हैं राशन लेके, वो सारे शहर के लोग लेके यहाँ से शहर में जाके वहीं भेजते हैं। हमें नहीं मिल रहा, ना हमारे पास टेंट है कि यहाँ बैठे हैं सड़क पे धूप पे ऐसे ही बैठे हैं। कुछ नहीं मिल रहा हमें, ना राशन है, ना टेंट है, ना हमें मच्छरदानी मिल रही।
Just sharing few clips. What I have seen in Sindh while I was returning back to Punjab, when I was in the bus, there were tears in my eyes. What I have seen, I have flashbacks, and I am really thankful to Allah that He has again given me opportunity, and I will be visiting Sindh again on 8th of October with the team of UCHS and Flood FJMU. Now, just coming to the solutions, how to manage. I think I thought about the solutions and only one answer came to my mind. Act timely and think as one nation. Now talking about in particularly management of physical health issues, as you have seen that there are fathers who are crying that they don't have any proper food, shelter for the kids. mother feel that they are no more having they can't breastfeed their children because of their poor nutrition. And you have also seen a girl complain, losing her voice when she saw her brother dying in front of her eyes. Now, talking about the physical health issues and their possible solutions, we need to improve sanitation. As you have seen in the video, there were no proper washrooms, and they were forced to go into the open air for this specific need. And I felt one of the very important observation of mine was that many of the people were living in the schools. And what really hurt me is that the sanitation condition of those areas were also very bad. I felt that government should give some incentive to those flood refugee victims living in those areas, that they should play their part to keep their surrounding clean. There was no clean drinking water. Many times people were forced to drink the pond water. We can provide clean drinking water through boiling, filtration, or chlorination of the water. We should be more focused on providing proper nutrition, food, and supplements like multivitamins, specifically to pregnant ladies and children having malnutrition. There must be mobile health unit and teams. Though we are sending volunteers to the flood affected areas, but I sincerely wish there are many doctors sitting home without jobs. When we are donating so much towards this cause, I think that government should think, and we should suggest government to hire healthcare profession on the special recruitment for these flood affected areas, like we recruited doctors for the COVID or dengue. Reproductive health facilities with newborn and delivery kits should be provided. Provision of dignity kits for young girls, and a provision of routine vaccination should be ensured. And moreover, we should be promoting breastfeeding. Now, talking about the management of mental health issues, we should try our level best to reunite families as soon as possible. We should think about reopening schools in old or temporary locations, professional and psychological assistance, and recreational opportunities. Yesterday, I was having discussion with Vice Chancellor of University of Health Sciences. Let me share, when I went to the flood area of the Sindh, the most precious thing for the children was a toffee that I gave to them. I still remember the same girl that you have seen in video who lost her voice because her brother was drawn in front of her. She was totally lost, but when I offered her a toffee, I could see the shine in her eyes, and she literally hugged me after that. That's why I was suggesting my Vice Chancellor, Professor Masood Sadiq, that we as a university must think about arranging one play date or fun day. We should go to the flood refuge camps and arrange a one day activity when we take with us toys. We should distribute toffees and arrange games or the face painting for those children, because I felt that if in all these bad memories of flood, we will give a one day of recreation to those children, might have a very good impact. And then we should be providing jobs to poor or unemployed parents, and managing education. We should think about temporary learning centers. UNICEF is already working on it. And we should also think about early reopening of schools, but I think the situation tells us that it won't be possible in near future. And one more thing that we should think about, giving incentive to those people who will be joining back school in form of food to the students, or some cash to the families who will be sending their children to the school, so that they are not forced to work. Now, just summarizing my today's presentation, take-home messages that we must think as nation to mount an effective flood response and speak with one voice to the international community. Early interventions can prevent long-term physical, mental health issues and help children get back to school. International community in Pakistan should prioritize the well-being of children in rescue, relief, and rehabilitation process to save the future of Pakistan. The best time to act on this was decades ago. The second best time is now. Now the house is open for discussion.
Thank you, Dr. Wajia Rizman. Now I will request Professor Junaid Rashid, one of the best general physician of the children's. He is serving in the University of Child Health Sciences for so many years, and he has a large area of patients. He is very popular in practicing as a children's specialist. Professor Junaid Rashid, over to you, sir. Professor Junaid Rashid, sir.
Sir, उनका mic unmute में बात
I have unmuted.
माइक अभी तक नहीं हुआ सर.
Yes, sir.
Assalamu alaikum. Can you hear me?
Sir, yes, sir.
Yes, Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much, Professor Mulazim Bukhari Sahab. Thank you for inviting me for such an important topic. And Assalamu alaikum to all my seniors and my colleagues and all the audience who are on there. Professor Masood Sadiq Sahab, Dr. Wajiha Rizwan, and all my colleagues there. In fact, Wajiha quoted that a 14-year-old boy said that he is helpless. And I feel that I'm speechless because it was such a sort of a emotional talk by Dr. Wajiha, which covered almost all aspects. I had made my notes and I felt that Wajiha hasn't missed a single angle which I thought was to be discovered and to be addressed. And she has comprehensively addressed in detail whatever has happened with people in flood hit areas and what help we can do and what support we should render to them. And in this regard, you see, these are known as super floods. Pakistan faced 391 millimeter of rain, which was 190% more than the last 30 years average. It was named as super floods, which has affected almost 15 to 20% of Pakistan's population. And there are 33 million people affected, out of which 16 million children are there. Until now, we always feel that data is generally less than the true depiction. In COVID also, we felt that there must have been much more casualties and morbidities as mentioned in the data, because many a times when things happen, it takes a little while before they are fully discovered. So till now, 538 children have died due to diseases, due to drowning. Similarly, as Dr. Wajiha mentioned about the schools, almost 19,000 schools have been demolished or damaged or are unapproachable. And another 5,000 to 6,000 schools are being used for their harboring of the effectees. So this is a very important point right now. Now, how we can help? You see, what role can we play? I think that we should, although on our part, teams are going, I think we need to attach psychologists in our team, because you see, we can use our colleges where there are classes from psychology. We can ask the teachers wherever they are in the subject of psychology to give help, and we can request volunteers from different organizations like universities and colleges all over Punjab to join as a team of psychologists, psychiatrists, and that area now needs a rehabilitation which is much related to beyond food efforts. We have talked of mental health. You know, right now, fear is the biggest problem they are facing. Safety is another problem which they are facing. Deprivation is a very big problem. Psychosocial trauma is a very big problem. They don't have an area to play. They don't have an area to study. So on top of that, they're always in fear, because as Dr. Wajiha mentioned, that many of them are afraid when they see water. It's still raining in many of those areas. And if you are already having water around and you are being poured through water as well. The girls and boys in Pakistan are facing the problem which they did not cause because the climate change, they were never responsible for it. So we have to make our own teams. Okay, we can develop coordinations with bigger organizations, teaching organizations, universities like Punjab University, Government College University, Canadian College University, and many other organizations in order to develop better teams. Just like Wajiha said, that we need funding. I had made similar points that we need to join hand with the education department. Health department has to join hand with the education department. There can be mobile schools and teachers from different areas. As doctors are going, teachers from different areas should join hands with us, and they should go there for small activities, teaching activities and learning. Even I feel honestly that the religious parties at this time, they need to come up, the ulamas, they need to come up with their teams as well. And they need to have even the players of Pakistan, the cricket players, the popular ones, the hockey players, whatever game is popular in Pakistan, they need to join hands, because unless we create an artificial environment for them, which gives them a pleasure in like a hope to live, because you see, it is not easy to see your family members dying in front of you because of some unfortunate incidents which is like beyond your control. And for this reason, the psychological health is very important, because many of them, I'm sure, unfortunately must have lost hope to live. Because if a family member sees that 5 or 6 of his children have drowned and his wife has drowned, his money is lost, his whatever property they were having is gone, and there is no chance of their recovery, because still it is said that in many areas it will take another 2 months or might be 4 to 6 months before the displaced people can go back, and whatever they will see, they must have lost their degrees, whatever their education they have made, their vaccination areas, their vaccination cards, their history records, their school records, everything. You see, there's so precious documents you have at your place in your lockers and in your cupboards, which relate to whatever you have done in the past 15, 16 years. So it's not simple that many might have lost their identity. We need to open centers there for all sorts of, later on, we will have to have like Nadra centers, and we'll have to facilitate for their all sorts of recovery of whatever they have lost in the form of their documents. So it's a very big fight which we need, and we need a lot of help from all other departments. What we can do at a senior level is that we can collaborate with people with contemporary equivalents in other departments, and we can request them to join hand, because 2 more teams are going from Children's Hospital and in collaboration with Fatma Jinnah Medical University, and that is the time to take help from other. If we take financial help is in one form, and manpower with facilities is another type of help. And there you see, regarding the waterborne diseases, now it's all about dengue, malaria, and I consider even snake as a waterborne disease, because snake comes whenever there is flood. Similarly, diarrhea and things like that. So we have to focus on the drugs which are essentially required there. A list of essential drugs should be prepared by, I'll ask Dr. Wajiha to prepare a list of essential drugs which can be floated at all forums which are required, which we think at a given stage are required, so that every team which goes makes sure that all those essential drugs are available, so that whenever they reach there, they need help for that, that can be done. So I really appreciate the way Wajiha has done. She's been always on the forefront in any such disasters, and I'm proud to have her as my student, because she was my student in Allama Iqbal Medical College when I used to teach there. Then we had a good time together in Jinnah Hospital when she was doing her house job and her part 2 FCPS. And then we were lucky to reunite together in Children's Hospital as a team. And I've always found her very energetic and rather ambitious, you know. And it's very difficult for a female in our setup to be of that caliber, the way she has been performing throughout. And she's been an asset to the institution as well as to the community. And I'm pretty sure that her next visit will come up with a better sort of a service, which already we have rendered. And I'm sure that more team members will join Dr. Wajiha. With this, I conclude. I think Wajiha hasn't left any corner unturned in her demonstration, whatever she has told. But we need to be a little more like meticulous. We should write research papers on whatever we have seen, and we have to make list of things which should be provided to the people, whoever is going, in the form of a standard text through the government organizations with due on the basis of our experience. Thank you very much.
Thank
for
you
giving
very
me
much,
this
Professor
opportunity.
Junaid Rashid. Thank you very
Thank
much.
you for listening
Beautiful
patiently.
talk, beautiful
Thank you.
comments. Before I allow the things for the lot of words about the Wajia, but I will request Professor Masood Sadiq, Vice Chancellor of the University, to talk a little bit. Professor Masood Sadiq Saab, the youngest and energetic Vice Chancellor. I am looking your university within a very few years in the top universities of the world. Professor Masood Sadiq Saab. सर आवाज को अनम्यूट कर दें, अनम्यूट करें सर आवाज नहीं, हाँ ठीक है
जी. Thank you very much, Dr. Mulazim. I hope you can hear me. First of all, I would really like to thank you for giving us this opportunity to be here today and expressing our experience. But let me start by congratulating Dr. Vijaya first. I think that was a outstanding talk. As Dr. Junaid has already said, that she really did not leave any aspect of that particular topic that could be really reviewed by any one of us. So I must congratulate Dr. Vijaya. Excellent, very well done. Very proud to be your head of your institution, and very happy to be part of that faculty which you are member. And I think we have known Dr. Vijaya since she was a medical she was a fellowship student with us. She trained in Allama Iqbal Medical College, but then she came over to Children's Hospital, spent some time with us, passed her exam over here. Then I think if you want to really know about a person, you need to see how the person has progressed. And she decided to go back to her own city of Sialkot, where she developed the pediatric department. And then once she had contributed enough, she wanted to come back to Children's Hospital, and then she got that opportunity too. So first of all, really congratulations on your accomplishments, I would say. Now, first of all, I would really like to highlight a point that when it came to sending a team for flood affected areas, the first person who volunteered was Dr. Vijaya. And I was just thinking that being a female and knowing that you are going to an area where which is known, unfortunately, as not being very safe area, and being accompanied by so many people and unknown circumstances, going there for the first time. So I think it's appreciable the sort of motivation she had in terms of coming forward. And I think that motivation led to many other people. She was accompanied by 2 staff nurses who were females. And I'm sure I still remember one of them saying that when Vijaya asked them कि आपके बच्चे भी हैं तो आप चली जाएं, खुदा ना खास्ता वहाँ पे कुछ हो गया, तो उन्होंने कहा कि अगर आज मुझे कुछ हो जाए खुदा ना खास्ता और मैं इस दुनिया में न रहूं तो फिर भी तो मेरे बच्चे पल जाएंगे ना. So that was the spirit, I think, which took people really, and they went there and contributed to the cause of these flood relief activities. Now, I think there are 2 more things which need to be highlighted here. One, I think we should never forget as a professional, as a doctor, and as an institution, that we have a social responsibility. Yes, we are doctors. We need to look after patients. We have our primary aim of working in an institution where we are posted. But what about our social responsibility? Anywhere in the world, if you go and you talk to any organization, they have a social responsibility. And that social responsibility comes when you have a social disaster, when you have a natural disaster, when you have an unforeseen calamity, which has led to such a large magnitude. And that's where people should come forward. And I'm very pleased that our institution was also part of that relief effort, which took place. And 2 of our teams have so far visited. The second one was led by another associate professor of our institution, Professor Alia. Lastly, I think in terms of how we take it from here onwards, I think there are certain things which we have no control upon, and that is the political front. That is the front where major rehabilitation of these people is concerned. I think that's the job of the government. That's the job of the relief agencies. That's the job of the at a larger sort of front. But I think where we can contribute significantly, and particularly I look at University of Child Health Sciences, is the plight of children. 50% of the patients who are affected or people who are affected in those areas, and that has been the impression of people who went there, were children. And they were children of all ages. I was just watching news this morning and I was so upset, and it reminded me what Vijaya and other people have been telling me, that there was a delivery over there in the flood affected area where twins were born and both of them died because they did not have the right environment and set up for that delivery and subsequent survival of those twins. And I was looking at the face of the father and the way the mother was crying. It was so distressful. So I think we have a duty as a professional that we should make sure that whatever medical aid we can provide to these people, we must do that. Whatever way we can help these children and these people to be rehabilitated in our own capacity, we must do that. And I think if more and more reliefs are required in terms of medical, I think Vijaya and Junaid has highlighted the need for drugs, need for skin diseases, need for gastroenteritis, and so on. But I think the second aspect which has highlighted in terms of their social and other rehabilitation, I think we will look into that as well, whether we can contribute on the floor of University of Child Health Sciences. Professor Mulazim very sort of kindly suggested that he would like to join hands with us as well in terms of relief. Their teams are already working, I think, in KPK and other areas, but he said that he would be very happy to be part of the joint effort which is being done by University of Child Health Sciences and Fatima Jinnah Medical University. So I would really, in any further, I think, activity, we would be more than happy to involve them as well. So in conclusion, I think I would once again appreciate, I think the work done by Dr. Vijaya and her team has been tremendous, and we congratulate them. We salute the spirit which they have and the sort of I would say motivation they have, which actually motivates many other people in the community as well. And I think we look forward to far more contribution on part of the medical community, be it research, be it treatment, be it helping these patients or children in particular, be it social rehabilitation, be it mental rehabilitation, be it rehabilitation in a larger context. We will be very happy to be part of that. Thank you very much.
Thank you so much, Professor Masood Sadiq Saab, Dr. Junaid Saab. Preparation of the and volunteership of the Dr. Vijaya is no doubt admirable. Inshallah, in future, we three institutions will collaborate in rehabilitation out. मैं थोड़ा सा लफ्ज कहूँगा कि डॉक्टर वजिया का इस आर्टिकल लिखने में कुछ थोड़ा सा हमारा भी खून शामिल है। एंड जो आज का वेबिनार आज कर रहे हैं ना, ये 20 दिन बाद देखेंगे छपा होगा सर, पब्लिश होगा। And now Dr. Tahir is the head of the department. After that, Dr. Tahir, can you give few comments, because we have sent our third medical camp, and inshallah in future we will collaborate in rehabilitation with the University of Health Sciences. Professor Masood Sadiq is very kind, and I also visited Professor Khalid Masood Gondal. He was also very kind to collaborate the three institutions to work unitedly. Dr. Tahir, Ji Tahir.
Assalamualaikum. Welcome to all participants, especially my colleague Dr. Masood Sadiq. I appreciate all these useful activities. We can understand we have faced such disaster in earthquake 2005, and at that time children had a more post-traumatic stress defects, you say, disease. We have gone through like malnutrition and separation of the children from their parents. We had faced, and this is the same situation we have faced in a flood disaster. It has the same, but it's more vast. If I say, yes, it has affected almost 3 provinces, even all 4 provinces, like in Swat, Ladakana, Balochistan, even in Punjab, Rajanpur, etc. All Pakistan has been affected. Yes, it is our duty, being a pediatrician, to look for these problems. And inshallah, we shall do it, and we have learned a lot of things from it. Thank you very much.
Thank you, Dr. Tahir Aziz. Now it is open for the question and answer. Dr. Jiar, you wanted to talk something?
Sir, yes, sir. Sir, first of all, thank you for all the kind words, especially to Professor Junaid Sahab and Professor Masood Sadiq. Undoubtedly, they both are my role models. Specifically, I always quote that I joined pediatrics just because I was totally inspired by Professor Junaid Rashid Sahab. When I was like every other girl of Pakistan, I was very much sure that there is only one profession, that's of gynae, and I have to join gynae until I met Professor Junaid Rashid Saab. He was taking our ward class, and I asked him, why, sir, you are a pediatrician? And he told me that you spread hopes and you spread smiles. 90% of the patients in pediatrics are totally healed. When they go back home, they don't have any disease. They are very less chronic ailments in pediatric age group compared to adults. And this was the point. I started idolizing him. I have always followed his footsteps, and I am lucky enough that he is always at my back guiding me. And then when it comes to Professor Masood Sadiq, he has been my supervisor during my fellowship for pediatric. He was my supervisor in cardiology. And then when I joined Children's Hospital Lahore, I was totally owned, and I was lucky enough that I have always been highly supported by sir. As far coming to the research, yes, when we were going to the flood camp area, I talked to Professor Junaid Sahab and VC Sahab that when we are going to the flood area, our camping should be different from that of any general practitioner, or that we must be much more focused as a university to produce some research work. And let me tell you that one of our publication is under review in an international journal, and soon we will be coming up with more research, published research, hopefully. And thank you, Dr. Mulazim Bukhari Sahab and PMA, for giving me this opportunity, because this topic is very much close to my heart. Because what I have seen there, I feel if I do not communicate to the people when we are requesting international bodies to help us, international donors are already fatigued due to the humanitarian crisis in Ukraine and Afghanistan. This time we must think as a nation, come forward, raise our voice. And when the whole world is being focused on our issue, our focus is on cricket, TikTokers or YouTubers. This is the right time. I am very delighted that PMA took this initiative to highlight such a pertinent issue when 1/3 of our country is underwater. So we need to change our priority. Since the day I came back from flood, sir, literally, let me tell you, I can't leave food in my plate. I can't think of leaving water in the glass, because I have realized that this is so much precious. Thank you, sir, once again.
Thank you, Dr. Saima Batul, Professor of Peds from the University, Lahore University. Dr. Saima Batul, you want to ask? Dr. Saima Batul. You can unmute, Dr. Saima Batul.
Assalamu alaikum, everyone. I'm Dr. Saima Batul from University of Lahore. I'm Professor of Pediatrics at University College of Medicine and Dentistry. I have listened to this great talk, quite admirable as well as, I must say, inspiring, especially listening to Dr. Wajiha's first-hand knowledge of working in an area where the flood was affecting a large.
Thank you, Dr. Razak Saab. You have commented, Dr. Razak. Dr. Razak Saab, you, Dr. Abdul Razak, Dr. Abdul Razak Saab, you can unmute. Yes, Doctor.
Thank you. Thank you very much for taking a comment from me. It was a very well organized webinar, and unfortunately, I am just out of my home due to some emergency. But I would like to highlight that the people living in the flood areas are very much deserving at the moment, and we should look like a family, because whenever there's a problem in our family, or some life is lost, or some disaster is in our family, then think about how it happens, what impact of the life is there due to this loss. So we should contribute maximally, and we should join hands with the University of Child Health Sciences and all the medical organization to help these people who, and our medical fraternity, who is going to contribute a lot in the Sindh, Punjab, South Punjab areas. And I would like to congratulate the first mission, which was highly appreciated in all the medical faculty fraternity, that the University of Child Health Sciences took an initiative, and we are proud of our supervisor and teacher and mentor, Professor Masood Sadiq, his team, Professor Junaid, and then Professor Khalid Masood Gondal. And I have just came to that some other same second or third group of these medical camps is going to be there in the Sindh. So I would like to contribute in the form of financial support, and I will ask my colleagues to, if they can join this camp from Faisalabad, so
Thank
that
you. Thank you, Dr.
help
Razak.
from-
Thank you so much.
Thank you.
Thank you. Doctor, last question, Dr. Abdul Khalik, Head of the Department of Medicine, Dr. Abdul Khalik. Dr. Abdul Khalik.
Sir.
Dr. Abdul Khalik.
Assalamu alaikum. Sir, thank you very much, and especially the Professor Mulazim Hussain Bukhari Sahab and Salma Kundi Sahiba, and the PMA providing this forum to discuss the issues through which Pakistan is going, and the calamity and catastrophe which is with us in decades. Dr. Wajia Sahiba and Dr. Junaid Sahib have already highlighted every aspect of it. Although the focus was the pediatric population, but everything goes to internal medicine, or preventive medicine, or those people who are even in the field of rehabilitation and doing the social work over there. They have almost touched each and everything. There's nothing much to add, but as Dr. Wajia Sahib has said, that these children are dependent on caregivers. This is the situation which I think is that even the adults are now dependent on caregivers in a number of situations, and the emotional trauma to the children, and same is true for the adults as well. The catastrophe through which these people are going, this population is going, it is equal for both children and adults, and for the community as a whole. The people who are visiting there, and they're coming with tears in their eyes, and the sort of catastrophe which they are looking at, when there is no shelter, when there's no adequate food, there's no medical help, and one can just imagine and just have a grief, and just that sort of emotions. And the health issues which Dr. Wajia has already touched about, there's a number of things, I mean, waterborne, and then vector-borne, and then immediate and intermediate and long-term problems from infections, waterborne diseases, dysentery, cholera, hepatitis, and enterics, and skins, and whatnot. Just name a disease, and it will be there with these people. Especially this is the season where we have a number of patients who are coming with malaria and dengue. And on top of it, when there is everywhere where there's water, and these people are more vulnerable to these conditions as well. These people don't have access to clean water, and everything is underwater. I mean, the latrines and everything, and these patients are using the pond water, and the dry land around that pond is a washroom or a latrine for these people. and that pond is a drinking water for these people. So we have to go through it, and I really appreciate all the social and emotional aspects which Dr. Vijaya has touched, the anxiety and insomnia and depression and stress and psychosis through which these people are going, children and adults as well. I really appreciate this forum that highlighting these issues at this forum, and creating an atmosphere in which we can discuss all these things. And thank you very much, Professor Mulazam Hussain Bukhari Sahab, and a very enlightening talk by the worthy speakers, and nothing much to add. And thank you very much.
Thank you, Dr. Abdul Khalik. Dr. Vajia, one point that is coming in my mind, and Azad Jammu Kashmir Medical College has started this work, I think, 1.5 months earlier. एंड मैं ये सवाल पूछूंगा आई थिंक डॉक्टर मरियम जुबैर से, गायनेकोलॉजिस्ट से, ये तो बच्चे जो आ चुके हैं, व्हाट अबाउट द चिल्ड्रन हु विल born in Dr. Junaid in future, what will be their how will the affect flood on the on their health, because their mothers are so much suffering from this. Dr. Mariam Zubair, Dr. Mariam Zubair, Dr. Mariam Zubair is a gynecologist, Azad Jammu Kashmir Medical College. You are here. Okay, you can unmute. Dr. Vajia, you want to say something?
Sir, we did highlight this point by telling that as the mother are deprived of the nutrition, that's why we are expecting that they would go into preterm labor because they are going through a lot of stress. We might have preterm labors, and the children, babies who are born might be having intrauterine growth retardation. And the most long-term impact on the physical health will be on those who will be affected within the womb of the mother. That means the fetuses. And as Professor Masood Sadiq shared news, he listened in the morning that the 2 newborns who had the delivery at the camp area died. The 2 newborns died, and just consider the agony of the mother who was carrying them throughout the flood. One of the father told me he had to choose that whom he had to save, either his kids or his pregnant wife. And the mother used to say that when I have seen my kids dying in front of my eyes, how would I be able to focus on my nutrition and take care of the one in my womb? So it will not only add up to the neonatal mortality, but the children, we are expecting that they will be having intrauterine growth retardation or low birth weight and prematurity. So I also suggested to Professor Masood Sadiq Saab that we have organized a children's first aid course in our university, where we train caregivers or non-health professionals how they can resuscitate the babies. And we were thinking that we should organize such training programs in the flood affected areas, where we will be training the caregivers or the flood victims that how can they resuscitate those babies if they have unexpected deliveries at the flood area.
Oh,
thank you, sir.
Thank you. Dr. Junaid, what will you add on this? What about the futures of infants who will born after 1 or 2 months? Dr. Junaid, Rashid.
Jiha has already mentioned, you see, we are anticipating maternal infections during pregnancy. So we can anticipate that there may be like more rubella babies born and many other infections which affect mothers in during pregnancy and later on cause effect in the babies being delivered. We can request the authorities to help us prepare
this is a very important
nursery,
point.
a small nursery type there, because you see, in fact, the area which is affected is such a large and wide area that it would be very difficult to provide services at all corners. You see, it's a huge areas and thousands of miles have been affected with water, and a large number of health facilities are like underwater. Yet we can establish a small, you see, in China, they develop their setups on temporary basis and then they can demolish it. A small, just now we had a special arrangement in for COVID vaccinations, and we had many hospitals for COVID, etc. Similar arrangements can be done
Yes.
deliveries and looking after of newborns. And for that, some equipment can be helped by various hospitals and authorities. I see the senior people which we represent and our seniors, Masood Sadiq Sahab, and having influential voices around. Yes, we will face problem because it's
Yes, we
another
can.
province. It's another province, na. Had it being Punjab, so in Punjab, we can make our own influence. But in other province, obviously, we need the support of whatever government and establishment is sitting there. But we need to develop a future plan in the form of mini labor rooms and nurseries, at least with minimum basic requirement of cheaper warmers and comparatively cheaper incubators, even used one from different hospitals, so that the babies can then be transported, ambulances, they can be transported to nearby bigger hospitals or comparatively equipped setups for their survival. Otherwise, it's going to be a big disaster. Just like an atom bomb, Hiroshima and Nagasaki kept on having the effect for decades to come. So we can't afford as a nation. We've already lost. We don't have money. We are close to bankruptcy. We already need cash. We are in debt. So that is the time that we cannot lose further human resource. And we are already having 40% stunting in those areas. We can't afford having a 70% stunting later on. That will be a disaster for the future to come. So this is the time to look into those mothers as well who are expected to deliver. Please.
Thank you so much. This was a beautiful suggestion. And inshallah, next webinar on next Sunday, we will also invite the gynecologist to talk on this topic, because aane wali nasals ko, Dr. Lubna is one of my students in 4th year. She mentioned that the Urdu is our national language. Dr. Lubna, no doubt, but there are so many other international speakers who cannot understand the Urdu. That is why I requested Dr. Wajia to give the presentation in English. No doubt we'll have a talk with the 4th year MBBS students for you in the Urdu. And thank you very much, Dr. Masood Sadiq's very effective voice. I can myself help, and my team can help you to raise the voice so that we can save the people. We are not only saving the children, but we can save the people who will born in the future. Inshallah, we will join hand with. Oh, one more question. Professor Munir, we are going on. You can ask last question. Last question. Dr. Munir, you can ask. Dr. Munir, you can ask. Professor Munir is the professor of, yes, pathology, is the teacher. Professor Munir. Anyway, we are not hearing you. Dr. Abed Karim, you have raised the hand. Dr. Abed Karim, Professor Abed Karim. Dr. Abed Karim.
Yes, sir. Sir, I just wanted to add that we were discussing about establishing a temporary hospital or temporary structure. All of us know very well. Yes. Sir, but I just want to add that all of us know that even at very small town levels, we have got very well established basic health units. And at most of the areas, these basic health units are just abandoned buildings. Buildings are there, but cows and goats are roaming about, and dogs are roaming about, and they are not being used. We can involve in our webinars, and we can involve the director health or
Dr.
district health officer.
Can involve because
yeah,
we have
exactly.
very effective voice. Yes.
Even we can involve our secretary health, that we can mobilize these basic health units for this purpose for a time being. They can hand over these basic health units to these teaching hospitals for this relief work or for this rehabilitation work, and after that they can take it back. And in this way, these basic health units will also become functional also, so it will be a double function, double benefit for that. Thank you,
Dr. Munir, you are asking something. Can you immediately ask Dr. Munir?
It's a very short comment. Thank you very much, Professor Mulazim Hussain, to give me the forum. I am thankful to Professor Wajia As a senior pro, I think so much has been said. I will not add anything to it. But what I would advise to the people who are involved in all these activities, and that is coordination, coordination, and coordination. The government should come up, the government should develop a website and a dashboard, keep and telling the people who are involved in these activities that what are the places where the help is required, where the relief work is required, where the rehabilitation is required. We have not learned from the disaster of earthquake. You see, I have seen people going to the same area again and again. There are areas which get the maximum benefit and there are areas which are neglected. So I would request all the NGOs, the government agencies, and the universities and the colleges and the different departments to set up a sort of a coordination. If the government is not coming up, they should set up a coordination. This is the only comment which I can give to such learned people, you see.
Thank you so much, Professor Munir. I will request Dr. Masood Sadiq to conclude the session, sir. Over to you, sir, for conclusion, sir.
I think, Professor Mulazim, thank you very much. I think essentially everything has been said and concluded. I would really like to thank you for organizing this webinar. I think this was need of the time, and I once again thank all the speakers, all the contributors who have really contributed and gave very valid suggestions. I think whatever needs to be done at institutional level, we will definitely do. Whatever needs to be conveyed to the government authorities, the secretary, minister, and so on would be done, inshallah. And I think we look forward to a very close collaboration. We as a nation have a habit of forgetting things very soon. So I think one thing which is very important is that we must remember that these people need a long-term rehabilitation, and we must not and we shall not forget them at any stage, and we should continue our effort of rebuilding our nation. I think one last point in conclusion would be, I think we need to also, at whatever forum we can, we need to tell the government that they need to take protective measures, long-term measures, to prevent such a catastrophe in future. And I think that aspect needs, otherwise every year with this weather change and with this international sort of scenario, we would be facing such calamity in this country. So I think we need to take long-term measures in terms of protecting these people from any future disaster as well. And that's something which I think we must highlight at every forum wherever we can. Thank you very much, Dr. Mulazim.
Thank you very much, everyone. Thank you very much, Dr. Wajia. Thank you very much, Professor Junaid Rashid. Thank you very much, Professor Masood Sadiq. Thank you very much, Tahir. Thank you very much, Khalid. And thank you very much, all the forum students. Inshallah, sir, we will write these things in the form of an article. We will publish this in the articles because our voice will be in the form of academicians, and we can give this suggestion to the government. And I think your cooperation will be always available for us to give this, raise this, our voice to the authorities. Inshallah, everyone is committed to help the disaster. No doubt we targeted. But inshallah, Pakistani कौम की एक सबसे बड़ी खूबसूरत बात होती है कि जब ये इकट्ठे हो जाते हैं ना, they can defeat any type of the calamities. Thank you very much. Inshallah, we'll meet next Sunday, inshallah, hopefully in this forum with the continuation of today's things which we have noticed. Inshallah, we will invite the gynecologist. Thank you very much. Thank you very much, everyone. Allah Ta'ala आप सबको हिफ्ज़ अमान में रखे. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, ji. Khuda
Thank you,
Hafiz.
ji. Thank you very much. Khuda Hafiz.